So just keep that in mind when your doctor might suggest, hey, we've got this new drug, it'll build bone density. The real question is, how does it reduce fracture? Recently, I came across a very interesting article looking at these new bone drugs, what they call anabolic bone building drugs, these drugs that are able to build bone maybe even 10%. There can only be used 2 years because of certain negative side effects, but the point is they do build bone. These are things like Forteo, Tymolus, and the last drug is called Evenity. So one knows, hey, they build bone really nicely, but what about their ability to reduce fracture? This recent study looked at the fracture reduction value of these drugs, and I was really pretty impressed, and I think people should know about this. Using these drugs for 2 years, which is the maximum you can use them because of the concern of harmful, even life-threatening side effects, after 2 years, these drugs did not reduce hip fracture by any significant amount. So they're not effective for hip fractures. They were able to reduce vertebral fractures by totally absolute risk reduction of 1 to 4%. That means 100 people had to be treated to prevent 1 to 4 vertebral fractures. I would say that's a pretty low benefit for a drug that costs $20,000 a year. Remember that they do not prevent hip fractures at all significantly. They help spinal fractures, but non-vertebral fractures of all sorts are not prevented by these drugs. The rest of the blog explains some of the other details. Read it carefully. There may be a role for these drugs among certain people, but there are many limitations, and they do not prevent fracture the way that you might be thinking. Okay, be well, and we'll talk soon.